Hi everybody. In today's video, I'm talking to Rachael Brown, who is an infection prevention lead nurse who works for Nuffield Health in Warwickshire Hospital. I've got a bit of a sore throat today, so do excuse the throat. Rachael recently implemented a fantastic sustainability change in practice that focused on the removal of paper couch covers. And these are sort of covers you'll see on trolleys and couches across the UK, from GP practices, hospital outpatients, A&E trolleys and day units. Rachael is going to talk about the impact of her project later, and such as 55 miles worth of paper that would have been used on couch covers, which will be saved a year. And she's going to talk through some of the cost savings related to her project. Rachael won the Florence Nightingale Green Leaders Programme Award for her project, so well done, Rachael. I'm delighted that she's sharing her change management project, and she will talk through the future support and the support that she received from the Florence Nightingale Foundation that really helped her progress this project. So this video is helpful for any early career nurses and students who are planning service improvement projects, or any experienced nurses who are on management or leadership modules as a fantastic example. I think Rachael's example is a great, project is a great example of a sustainable project and a service improvement project. The fact it's a simple idea that's going to have such a massive impact on services and on cost and sustainability. Rachael is passionate about sustainability in healthcare, which I am too, and it's something that we all need to think about as healthcare professionals and students. So finally, do check out any other of my free videos. They all aim to support nurses' career development. Don't forget to give the video a thumbs up if you enjoy it. I've got lots of other videos on my YouTube channel. If you want to subscribe, they're free and they come out on Sundays. And this video is part of the series of inspiring nurses who are positively influencing our profession, which Rachael certainly is. And I've just handpicked a few projects on my YouTube channel because I think they're so interesting and are so impactful. So welcome, Rachael. Thank you very much for giving your time today.
Thank you, Carol. That was a lovely introduction.
You deserve it. So could we start by giving the viewers a brief introduction about your career so far and your current role?
Yeah, so currently I'm the infection prevention lead nurse at Nuffield Health, Warwickshire Hospital. We're an independent healthcare provider. Nuffield Health is actually a charity. We're the biggest healthcare charity in the UK. And my role as infection prevention nurse is a very varied role, and it's all about kind of ensuring patient safety right from the start of their journey through pre-op, intraoperatively, and then post-op and after discharge as well. And prior to having this role, I worked a couple of different nursing roles, mainly on the wards for the NHS and also in ITU. And it was very much in ITU that I got into infection control because it's very detail focused, and I did some link work in that department. So
Thank you, Rachael. And Rachael has kindly offered to do a video on tips on how to become an infection control nurse. And she's obviously a lead nurse as well, so going into leadership. And I'm often asked that by early career nurses. So that's going to be another really good video. And thank you for offering your
you're
time
welcome.
again. So what I'd really be interested in you, first of all, just going through where the idea for your sustainability project focusing on couch covers actually came from, Rachael.
Yeah, so I am, as you said, I'm very passionate about sustainability as a whole. And I think lots of us make lots of changes in our home lives in terms of reducing, recycling. And yet, when it came to work, it felt like there was a bit of a disconnect between that sustainability efforts and healthcare. And the idea for this project was actually initially given to me by our physio department, who asked me why did we need to keep using the couch covers, and it sort of took me took me a few minutes to process it and think, well, actually, all of our couches, as you said, are, they need to be made from this smooth, impervious material. They should be wiped between every patient use, regardless of whether they're covered. So I started thinking, what is the purpose of the paper? um, and once I kind of had that idea, it got the ball rolling on, well, shall we start reducing them and start removing them where possible?
That's fantastic. And it's really interesting that it's from you sort of networking with an allied health professional and talking about sustainability. And it's interesting because there are people, and I saw it recently, where people would question taking away the couch covers. And I know we discussed that a few weeks ago.
Mm.
And you're not saying that that's the case. Do you want to talk a little bit through about the risk assessment and where you might leave couch covers in place? Because you're not advocating to do this across all couch covers. It just depends on the situation.
Yeah. So initially, when I started looking at this idea, I I created a risk assessment or a flow chart where I thought, okay, there are going to be instances where perhaps couch covers are useful, and this would be if the patient was going to be having a particularly invasive procedure with a higher risk of blood or bodily fluids. So sometimes it might be something like a smear test or um, women's health, particularly. And in that instance, the couch covers can be useful for sort of an absorption kind of purpose. And similarly, in radiology, where they do scans where they use lots of jelly, they felt that sometimes the paper was useful to help remove the jelly or almost as a modesty purpose. So that was my initial sort of, right, well, let's do a risk
Yeah.
assessment flowchart and I'll get clinicians to kind of decide, does it need to be used or not? But as with kind of any project, as I started creating this risk assessment and I proposed the idea to the people using it, the feedback was actually, oh, this is just another thing you're asking us to do, to stand here and go through a flow chart for every single patient we see. We might have 50 patients on a clinic list. I'm not going to stand there and go through the chart every time. And I went away and I thought about it and I thought, yeah, you know what, you're right, let's be more streamlined. So then I created a poster campaign which aimed to sort of suggest, let's remove the couch covers where possible and ensure that all the staff know that they should be cleaning the couches between each patient use, because it was surprising that not everybody did know that, and that the covers are just, they're covering up any pathogens if you're not cleaning between them. Um, and in those areas where it, or clinics where they would be doing those procedures, we allowed them to keep the rolls there for those clinics. And then when they finish, take it away or put it away. So it's not just part of that every sort of room setup, couch covers out. And that was the way we went with the project.
Yeah. And it's really important, as you said, to have that ongoing engagement, because if you look at, so some of the students will be looking at service improvement, quality improvement models. So if you take like Lewin's model, for example, you've
Mm,
got the unfreeze and then you've got the solidify, and you're not going to be able to maintain a change if it's not practically applied and it's not feasible on a day-to-day reality basis. And that's what's amazing, that you did that, you got your feedback and you changed the approach, and you have to do that with service improvement projects and quality improvement projects.
absolutely. The people who are you're asking to do the change need to have their say for it to work operationally.
Yeah,
So yeah, absolutely agree. You do need to get their engagement and get their feedback if it's going to work. And I
yeah,
think by doing that, people are generally more engaged because
yeah,
you're listening to them and taking on board other points of view and other suggestions rather than just, I'm telling you to do this, you're going
yeah,
to do it.
yeah, yeah. It's partly an autocratic approach to it, can it? That's the thing.
Mm.
So with any change, if we look at the PDSA cycle, which a lot of the students will be using, the preparation and the doing. With the preparation, you need a baseline usually demonstrating the difference for your impact. So could you talk me through what data you used or how you sort of scoped at the beginning so you could show impact and change in the change that you implemented?
Yeah, so initially I needed to ensure that there wasn't any policies or guidelines which sort of explicitly said you must use couch covers or couch covers should be used for this purpose. And through doing that, I couldn't find any sort of national guidelines that said anything of that sort. I went through all our local policies as an organisation, and again, there was nothing where it said, you must use covers. The only sort of policy which really even mentioned it was that couches must be cleaned between each patient use. So once I sort of felt satisfied that there was nothing, I wasn't asking people to change outside of a policy or go off, you know, out of
Yeah,
license, so to speak. I
yes,
then went about researching within the hospital and getting
yeah,
the different departments authorization. So making sure that my director of clinical services, so my line manager was on board, that the heads of the department were on board, um, so that it could sort of be implemented much easier.
yeah. And do you want to talk through, is there anything else with authorization? So you started to talk about authorization, which is paramount in any change, and to have people on board. Is there anything else you want to sort of, was it just mainly going through sort of senior people in your trust, and or was there any other sort of
So
authorization that you needed to implement?
So I had to make sure that sort of, the director of clinical services at our site was on board, that the heads of department were on board. But I did
Yeah.
also run it through the more sort of senior leadership team within Nuffield Health. So that was our national head of infection control, and just make sure that
Right.
they were also aware that this was something that I was planning to do. And
Yeah.
actually, they had also discussed this idea previously. So I wasn't, I wasn't trailblazing in the sense that it was a unique idea, but it was very much making sure that it, particularly because I had ambitions that perhaps we could expand this more than just my one local hospital, that this would be something that could be expanded out to
Yeah.
other Nuffield hospitals and potentially further in the future.
Yeah. And anything else with phases of implementation? Was there anything else, any tips for anybody out there, or anything else that you feel you want to share about the actual implementation process at all once you'd got authorization?
Um, I think it's just getting that engagement.
Yeah,
So speaking to the people who will be making the change and getting them on board with the idea. So for me, that was going to outpatients, speaking to the nurses, sort of giving them the poster, giving them some education in terms of, making sure they knew why this was a sustainability initiative, and this is what we're looking at improving, and trying to get that engagement. And also, consultants and all the different departments that use it, making sure they were aware of it. So sending out communications so that they've got them to refer to, doing little sort of education sessions, and just making that sort of sustainability message very clear.
and that's so important, Rachel, that because people forget, they think, oh, this change is just for nurses, but actually it has a knock-on effect because all the allied health professionals will be potentially using couch covers in some capacity.
Yeah.
And did you find that there was any challenges? Was there any, and if there was, how did you overcome them? But was there any sort of challenges there with
Um,
along the way, or
some
resistance to the change, maybe?
Yes, some resistance from certain people where they felt that the couch covers, they made the couches look more appealing, particularly within independent healthcare. You like to have that image of high end professionalism, so they questioned that. And then also just making sure people knew that this was a trial, and even if we can't remove them completely, let's reduce it. Let's just stop putting
Mm.
it on every single couch for every single person who comes into a room, whether it's for pre-op or physio, for for radiology, when they don't need it. Let's be more mindful of it. So I think the biggest challenge was really getting that message, and just trying to sort of push the sustainability message, because
Mm.
I think sometimes, and particularly in healthcare, you do go through lots of changes where you don't really know why you're doing them, and you're just told to do them. So I was very keen to kind of get people aware of, this is not a cost cutting exercise, although we will save some money. Um, it is, this is the sort of rationale behind it, and pushing that message rather than just leaving it as, I want you to do this, please do it.
And you've really shown the amount of communication and working across services, working across different teams, how important that is to the success of a project, the networking that you did, and all of that sort of preparatory. I can't speak today. I've got terrible hay fever and a cough as well. Preparatory work. And you started to talk about impact. So, and we sort of talked, I was shocked actually, Rachael, because we met a few weeks ago, didn't we? And you were talking through the impact of your project. Do you want to sort of try and detail some of that impact that this project has and may have in the future?
Yeah, so I think what I learned through the Florence Nightingale Foundation was, um, looking at quality improvement projects, particularly from a sustainability perspective, is there's three very important elements you need to consider, which is sometimes referred to as the triple bottom line, which I like to call the three Ps because it's easy to remember, which is, what's going to be your impact on profit, what's going to be your impact on the planet, and what's going to be your impact on the people. And by having that sort of breakdown, I was able to sort of show the impact that this simple change would make. So, in terms of the impact of reducing couch covers on our profit, at our small independent hospital, in 1 year, we spent nearly £4,000 on couch covers, plus an additional sort of £800 on waste removal costs, um, which could, be recouped back, and put back into improving our services elsewhere if we were able to reduce that amount. In terms of our planet, I was also quite staggered at the impact that pieces of paper will have. So in 1 year, at our hospital, we used over 2,220 rolls of couch covers. To put that into perspective, that is over 55 miles of paper, in 1 year. That's the same distance between Oxford and London.
Wow.
Um, so huge amount of paper that is just sat on and then put straight into, a waste stream. That waste stream would be, the amount that we used was nearly 4,000 kilos of clinical waste. That would have either gone straight to landfill or potentially incinerated, depending on what waste stream it was put into. And in terms of our carbon emissions, you can use these carbon emission calculators, which look at manufacturing of the product, transportation, removal costs, and it was over 4,500 kilos of CO2 per year. So huge.
So it's such an impactful project, something as simple as taking those couch covers off. Um, you need to be commended for the work that you've done on this. And do you think your initiative could be mapped, because it's so impactful, could be mapped across the UK or in other services? What's your view on that, Rachael?
Yeah, I mean that, like you said at the beginning, they're used widely throughout healthcare in a variety of different settings. And just at Nuffield Health alone, we don't just have hospitals; we have wellbeing sites, GP services, gyms, and all of those sites use it. So just in our organisation, scaling it up, the cost saving is huge. It's over £82,000. It's over 1,500 miles of paper, and I'm not, I think that the beauty of the project is that I'm not asking you really to do anything differently, because you should be cleaning the couches between each patient
Yeah.
anyway. It's just not, we're just not using it. I'm not swapping one thing for another. It's just simply removing it, and it could absolutely be scaled up to other organizations. And I'm very keen and hopeful that other organizations would like to trial this. I'm speaking to a couple of NHS and ICB partners who are interested in doing it in their GP services. And absolutely, it could be, if we measured how much couch covers was used in healthcare in the UK alone, I wonder if we could go all the way around the world with the the amount of paper that's used
Yeah.
per year. It would be huge.
And that's the thing. It's so interesting to hear the amount of impact it's had, but also it's about the importance of sharing your work. So if you do a change as so impactful as you, and I'm hoping the platform of putting it on my YouTube channel will help you in some way, but it's almost like we want everybody to realise what you've done and the importance of sharing your work. And I know a few weeks ago I talked about how you're going to share this amazing project. Obviously, Florence Nightingale we'll talk a bit about as well because they've been fantastic supporting you with this work. But I know you mentioned about planning on talking at conferences and the importance of sharing your work when you've got the positive results of something like this. Are you planning on sharing your work further?
Yeah,
If you talk through a little bit about the importance of
yeah.
that, maybe.
So I think that bit almost encompasses. So I mentioned the three P's. So I said, the impact on profits, the impact on the planet. So the third P is the impact on our people. So that is, the project itself is simple, and it invites participation from a range of different specialties. But the other impacts on our people is if we can raise the profile of sustainability
Mm,
through doing, talks, and speaking out at conferences, doing, opportunities like this, and empowering, the future generations of nursing or people who are just starting. Um, then it will just continue. And
yeah.
I'm not a natural public speaker, but it is something that I've sort of learnt to improve at as I've gone along. But if it means that I could get other people on board, then I'll talk to anyone about Blue Roll.
You're doing a brilliant job today. And didn't you do a publication as well? I saw
um,
something published in one of the
yeah,
national journals, didn't I? Because that's important as well to influence. It's about getting your voice out there, isn't there? Isn't
yeah.
it?
So I didn't write a publication, but it was picked up by the Nursing Times and the
Yeah,
Clinical Services Journal as a piece of work through the Florence Nightingale Foundation, and they reported on it. But what I want to do now, and what is part of the Florence Nightingale Scholarship, which I'm now doing, is getting this project more strategic. So I will be writing an article and trying to get it published somewhere about how I can expand this sort of small project into becoming this bigger project,
yeah.
and getting more people on board. So yeah, it's still a learning curve for me.
Oh, well done. And it's fantastic to hear that you're going for the publications and people can do it's almost like you can get people to write about your project. If you even if you'd like you said, if you don't want to write it yourself at that time, you weren't ready to write it, but somebody you can sort of talk about it to writers in journals. You can also collaborate with people on articles. And Florence Nightingale, I know, will give you loads of support with that as well. So let's talk a bit about I mean, I'm always promoting the wonderful Florence Nightingale Foundation. There's the Burdett Trust, and there's other foundations out there where you can do scholarships for leadership, for example. So do you want to talk just a little bit about your scholarship and what it entailed, just for people out there that are interested? Because that's what started it off, wasn't it, as well?
Absolutely. So the initial program that I enrolled in was sponsored, a collaboration between Florence Nightingale Foundation and Nuffield Health, my employer, called the Green Healthcare Leadership Program. And this is a sort of shorter course, It's around 9 months, where it looks at not only sustainability, quality improvement, but it looks at your leadership. So you get these opportunities to have workshops with the King's Fund, with RADA, which was amazing. The actors, Royal Academy of Dramatic Arts, they talk
Yeah.
to you all about projecting your voice, having more presence, and I'll be honest, when I initially went to that session, I had no expectations. I sort of thought, oh, breathing, talking, I can do that. Like, what can you what can you teach me about that? But oh
Yeah.
my gosh, I was blown away. Like, it's amazing,
Yeah.
the difference it can have on the impact and how you're perceived. So that
Yeah.
was, a huge benefit. And also meeting my course mates, who were from all different independent sectors, so not just Nuffield Health, all other organisations, and that's been a fantastic network to have. And we're still in contact now. And F&F have an alumni, where anyone who's done one of their courses, you can keep in touch and you can attend different study days. I would absolutely recommend it to anyone, or similar courses. They do a variety of different courses, but Green Leaders is what I started out with.
Yeah.
And through Green Leaders, I've got the scholarship, which is a similar premise, but
Yeah.
it's for emerging strategic leaders. So it's a longer course, and a sort of bigger, or making your project bigger. So that's what I'm
Yeah.
working on now.
And what you're showing as well, Rachel, you're being really honest today about your strengths and weaknesses, and we've all got them. And that, you're forever learning as a leader, but some of these skills are learnt through practicing. And I'm often saying to students that, when you see people on TikTok and doing their presentations, they've got cues and written in front of them quite often. They don't
Mm.
just naturally speak so eloquently for half an hour. But there's lots and lots of tips that you can learn, and through practicing and through getting guidance, like through the Florence Nightingale Trust, you're going to be learning all these extra skills, and the importance of getting your work out there after, when you've got this fantastic piece of work. So I hope it ends up like, hello, my name is, and it does go global. I really hope it goes global, because I think it's such a simple idea, and it's amazing to see it come to fruition. Um, so the only other thing I was going to think about as well with Florence Nightingale, they've got other scholarships, haven't they? I think they've got some out at the moment, haven't they? I might try and get somebody from Florence Nightingale on, maybe, to talk about
Yeah, yeah.
some of the scholarships. But where did you hear about it?
So, because Green Leaders was initially a collaboration with Nuffield Health, it was promoted through our internal sort of communication. So I saw it through that. But equally, um, the national lead had said, because I'd already been doing a bit of work on sustainability, she said, "Oh, this would be good for you." And it's like you said, you do keep learning as you go, because if you'd have told me, a year ago, 2 years ago, that I'd be standing up and doing presentations, I wouldn't have believed you. So um, it is a learnt skill, and you do get better at it. Um, but that's how I heard about it. But once you know about it, they're actually, they're a brilliant organization, and they do, like you said, all different courses, digital scholars, Windrush programs, all different kinds of leadership programs. So yeah, have a look, and I'm sure that there'll be something. They do long courses, short courses that could be of interest.
That's wonderful. Thank you so much for sharing your insights and your amazing project.
Oh,
I
you're
just wanted
welcome.
to finally, because I know you're probably really busy as well at the moment, but I just wanted to finally ask you for any advice. You're going to be, as lots of early career nurses and students watch my YouTube channel, and they're going to be really inspired by what you've said today, and also from your career pathway going into infection control. But have you got any tips for anyone that aspires to achieve what you've achieved in your career?
I think, be your authentic self, and none of us are the perfect nurse, the perfect leader, or have the perfect project. But if you're authentic and you have an idea of what it is you want to change, then do your research and stick to it, and keep going, because there will be setbacks, or there might be challenges, but people generally are good and want to help you. And if you can be your authentic self, then that tends to get people on board with your ideas, I think.
Thank you. Very wise words there. So hopefully you'll come back and talk a bit more about infection control as a career pathway as well. But thank you very, very much. I'm sure lots of our early career nurses and students out there will enjoy this video, and will it's very helpful for anybody doing service improvement or quality improvement to see that cycle, and to see, I think what you've given is the importance of the communication, especially at the start for these projects, and to have that ongoing communication, because you were talking about the fact that you changed the risk assessment, for example, from feedback. So for it to be embedded in practice and to sustain that change is very important. So thank you very much,
You're
Rachel.
welcome.